periodic health checkup for diabetes. In addition to the notes in daily living habits, people with type 2 diabetes also need to pay attention to periodic health checkups, including 1. HbA1c test. This test aims to check the amount of glucose bound to hemoglobin in red blood cells. Accordingly, people with diabetes have higher levels of glucose attached to hemoglobin than normal. The HbA1c index reflects the patient's blood sugar control status in the last 3 months. Based on that, the doctor can assess the condition of the disease and give the appropriate treatment. If HbA1c is less than 6%, it means that the blood glucose level is well controlled. There is no development of complications in the eyes, kidneys, cardiovascular and nervous system. In the care plan of patients with type 2 diabetes, if there are no special indications, most patients will be recommended to have HbA1c testing about 3 to 4 times per year. 2. Dental examination. As mentioned, diabetes causes many complications including dental disease. The reason is because high blood sugar damages the microvessels, thereby reducing blood flow to nourish the gums. Moreover, the sugar content in the saliva of people with diabetes will often be higher than that of the general population. This creates an opportunity for harmful bacteria to multiply and thrive. At this time, bacteria will combine with food in the mouth to form plaque, causing tooth decay, gingivitis. To prevent these problems from happening, the patient needs to brush teeth thoroughly after every meal. Regular dental checkups every 6 months, even if there are no abnormal symptoms. Limit the consumption of solid foods high in sugar and starch. Avoid the habit of smoking as this increases the risk of developing dental disease. Use dental floss to remove plaque instead of toothpicks. Use physiological saline to rinse your mouth after each meal. 3. Eye exam. According to many studies, high blood sugar can lead to eye diseases such as cataracts, blurred vision, glaucoma, severe eye pain, decreased vision, even as damage to the retina. Therefore, for people with type 2 diabetes, taking care of and protecting their eyes is essential. Because of these problems, the American Diabetes Association recommends that people get their eyes checked as soon as they know they have the disease. Because 1 in 5 people with diabetes have eye diseases just listed. To prevent eye complications, patients need to try to keep blood sugar stable, should have regular eye exams at least once a year. Particularly, pregnant women with gestational diabetes should have an eye exam every 3 months to ensure their health. If you notice any strange symptoms, go to the hospital immediately. 4. Vaccinations. Vaccination is also an important part of a long-term diabetes care plan. Because this will help patients cope well with pathogens from the environment. Remember, diabetes weakens the immune system, so the patient is at risk of contracting infectious diseases. If accidentally infected, the rate of patients experiencing complications or even death is very high. The vaccines that people with diabetes need to get vaccinated are influenza, pneumococcal, hepatitis B, diphtheria, pertussis, and tetanus vaccines. In addition, the doctor may also recommend that the patient get the chickenpox vaccine, zoster.